Hi guys, I am Dr. Naisha Bonnet, the Nurse Doc Tutor, and I am here to help you pass nursing school. If this is your first time on my channel, this channel is dedicated to helping struggling nursing students or those students who have graduated who have yet to pass NCLEX. So today's lesson will be on Reconstitution calculations. Let's go. Alright, our first example is, it says an order of clindamycin 665 mgs available is a vial of clindamycin powder. Direction is to reconstitute with 10 ml of sterile water to yield a concentration of 95 mgs per ml. So there are three parts to this question that you need to understand. So number one, what is the order? So the order says what? Clindamycin 665 mgs. So that will go here. And guys, I'm doing my best to write on here instead of, I wanted to make it easier. So bear with me. All right. And then what we have available is our 95 mgs per ml. All right. So we notice that 10 mls, that's just to throw us off. That is a distractor, okay? So 95 mgs per ml. All right. So the final question is, how many mLs will we administer? So we're going to start with our order. Now we just do regular dimensional analysis. All right, we're going to take our order, and then we know that milligrams has to go on the bottom because we need it to cancel out. So we go back to the problem of what we have available. So 95 mgs per 1 ml. So mg's cancel out, mg's cancel out. So we divide 665 divided by 95, and that will give us 7 mLs. So that's our answer. All right, so let's try another one. All right, example number 2, it says that the order is for Maxipine 0.75 grams. What you have available is a vial of Maxipine powder. Directions is to add 2.6 mLs of sterile water to yield 200 mgs per 2 mLs. All right, so what's the order? 0.75 grams. What do we have available? 200. So remember about those distractions. We don't need those distractions. So we got 200 mgs per 2 mLs. So now we're ready to see how many mLs will we administer. So we're going to start with the order. And what we notice is that, guess what? What the order is in is different than what we have. So the order is grams, but what we have is milligrams. So what do we need to do? We need to convert. Some may do it in their head. Me personally, I like to write it all out in dimensional analysis. So 1 gram is 1,000 milligrams. So grams cancel out. We go back to the problem to see what we have available. So we're going to do 200 on the bottom because mg's have to cancel out. So mg cancel out. And it's over 2 mLs. All right. So we're then left with, so you're going to multiply straight across. And you're going to get 1,500. And then we're going to multiply straight across, get 200. And then we're going to divide. Put that into your calculator. And you're going to get 7.5 mLs. And your question will let you know what you want it to be round to. Do they want it round to the nearest tenth? Do they want it round to the nearest whole number? And you would just go from there. All right, how did you guys do on that one? Let's try another one. All right, so this question says the order is for streptomycin 0.25 grams. Available is a vial of streptomycin powder. Direction is to reconstitute with 9 mLs of sterile water to yield 400 mgs per 2 mLs. So first we're going to start with what is our order, which is 0.25 grams. What we have available, we're going to be going to 400 mgs per 2 mLs, right? All right. So we know that in our order, we have it in grams. So we're going to go ahead and convert it to milligrams. Grams on the bottom because gram has to cancel out. So 1 gram equal 1,000 mgs. And then mgs have to go on the bottom. So we're going to do 400 mgs. And then we're going to put 2 mLs on the top. All right. So we're going to multiply straight across. And we're going to get 500 on the top over 400. Put that in your calculator. And we're going to get 1.25. So you will follow your rounding directions. But I'm going to round to the nearest 10. So we're going to get 1.3 mLs. And that is a wrap. So I hope you learned a little bit more about Reconstitution dosage calculations. Familiarize yourself. Keep on practicing over and over. Practice does make perfect. And if this was your first time here, I am Dr. Naisha Bunnett. I am the nurse doc tutor. If you need private tutoring, my information is listed on the screen now. And make sure you're following my Facebook group. Share this video and this page with other nursing students because my job is to help you pass nursing school. So I will see you guys in the next lesson.